Hi, everybody. I'm Bill Whittle here with my comorbidities, Steve Green and Scott Ott. And this edition of Right Angle, we decided we'd try something different. We're going to talk about the COVID pandemic for once.
Oh, I heard of that.
Yeah, just thought we'd just cover it since it's in the news. New study out. Following the study came out just a short time ago, Johns Hopkins said that the overall death rate in America has not increased significantly. That story was vacuumed out of the common knowledge pool and tucked safely away where the public cannot possibly read it. And now we find out, this will undoubtedly disappear in the near future too, that latest study that says that this is dealing with the United States now. 89% of the patients who died from COVID-19 had a Do Not Resuscitate order. DRN. Now, I would just like to state as an opening statement that I do not have a Do Not Resuscitate order. As a matter of fact, I have a Resuscitate order, and it's in 40-point Helvetica red underlined with 3 exclamation points. And below that, it says, Step 1, resuscitate. Step 2, proceed to Step 1. And so that's where I am right now with my life and my health. Now, we put the flipness aside because obviously there have been hundreds of thousands of people, well, thousands certainly, who have died of COVID-19, and that's not a joke, and I don't mean to belittle them. But what I am saying is this is just yet another data point of how selective this disease is. Steve, I want to say it was 2 months ago or something, 2-3 months ago, the Center for Disease Control, that Trump-run organization, said that 94% of all of the deaths from COVID-19 listed as COVID-19 deaths, 94% of them had 2.6 comorbidities. That's the average. A comorbidity, for those of you not familiar with the term, is something serious, another serious health issue, maybe serious diabetes, advanced heart disease, whatever. A comorbidity could be something that will kill you in a few days. And we found out in many cases, the way we record COVID deaths in this country, if you got hit by a bus and you tested positive for COVID-19, you're a COVID-19 case. And prior to the show today, during our backstage program, I said, I don't understand this. I don't understand why we're recording things this way. And all of a sudden, Steve Green stepped up and explained it all to me, made it crystal clear, and now we will have a chance to explain it all to you. Steve, why is it that people who die of heart attacks are listed as COVID-19 deaths?
Well, Bill, I'm glad you asked because I would love to share this with folks. And what I'm about to, I did some fact checking in between segments, and what I pulled is from a horrible left-wing organization called PolitiFact. They're one of those fact-checking groups, and PolitiFact is one of the banes of my existence over at PJ Media because I could write about how awful they are every single day until I literally was shooting myself in the head while biting down on a cyanide capsule because I'd be so damn sick of it. I just want to make it stop. That said, here's what PolitiFact said back in, I think this was back in June of this year. It's standard for Medicare to pay a hospital roughly 3 times as much for a patient who goes on a ventilator as for one who doesn't. That's not to say that they're making boatloads of money off of ventilator patients. It's expensive. Ventilators used to be fairly scarce, but then, of course, President Trump launched that huge initiative back in March or April to get all those ventilators produced. They're no longer a shortage of ventilators. Thank goodness. You don't want a shortage of those.
Seems that would drive the cost down, but go ahead.
Yeah, you don't want a shortage of those during a pandemic that is a respiratory virus. Thank you, President Trump, for getting that organized. Thank you, private industry, for delivering. Thank you, Medicare, for continuing to pay at an average of 3 times as much. Also from PolitiFact, Medicare is paying a 20% add-on to its regular hospital payments for the treatment of COVID-19 victims. That's a result of a federal stimulus law. I'm assuming the one that we passed.
Could you say that again, please?
Back in April. Yes. Medicare is paying a 20% add-on to its regular hospital payments for the treatment of COVID-19 victims. Isn't that interesting? So no matter what the standard code is, by the way, there's no reporting code that I'm aware of for hospitals and Medicare. So if you report that it is COVID, you get a 20% bonus on top of what Medicare was going to pay you for the thing that you did code payment for. 20%. Right. That's a big deal. I thought it was 15%. I thought, oh, no way could it be any higher than 15%. That'd be ridiculous. No, it turns out it's 20%. This is what economists call a perverse incentive. And it's why I believe you see stories like man hit by bus, cause of death listed as COVID. Man falls off ladder. Cause of death listed as COVID. These are real stories from the news. You can look them up. And if we know about them well enough that people have been joking about these stories for months, you got to figure it's more widespread than is actually appearing. We're probably seeing the tip of the iceberg on this. The PolitiFact story, and this is an example of why PolitiFact is just such an awful organization run by lying scoundrels. The author went on to say the claims suggestion, talking about the World News Daily report that was generating all the interest that PolitiFact had to fact check. The claim suggestion is that the number of COVID-19 cases is being padded, which is not what they're suggesting. They're suggesting that the number of deaths directly attributed or correctly attributed to COVID is being padded. But evidence indicates that cases are being undercounted. PolitiFact didn't list any actual numbers. It didn't list any actual evidence. It just asserted this claim. PolitiFact ignored stories like the two I just told you about, and the many more like it that have been the cause of so many jokes. So we know a couple of things. One, we don't know. And that's the worst. We have a whole slew of, it's a combination of, on the Rumsfeld scale, of known unknowns and unknown unknowns. Excuse me, that's the Rumsfeld epistemological scale. Let's be correct about this. We know the known unknowns that some number of cases, some number of deaths is being incorrectly attributed to COVID-19. We don't know what the actual number is. And now we have unknown, which is, well, that's the one that comes and bites you in the ass. And I think that's going to be the question you're going to ask Scott. So I'm going to lay off here and call it quits for the day.
Scott, just before we started this particular episode, you said, wouldn't it be great if we could do like a lab control experiment where people got honest information? We just recorded the show about the restaurant closure and the guy in Redondo Beach who opened a restaurant called put a big banner over his Eat at Joe's restaurant called French Laundry so he could get the same coverage that Gavin Newsom got. But just before this show, we were talking about, it sure would be nice if there was a way to do like a control group. And you said, where people got like accurate information and then left it up to everybody to kind of make their own decisions about how much risk there was, how much risk they wanted to take. And I thought, what would you call something like that? I guess you'd call it a free country. That's what I think you probably would call that control group. So you want to speculate on this because this is data. And it goes all the way back to Elon Musk taking Tesla out of California when he said, here are Governor Newsom's projections, and here is the actual numbers of beds. This is a guess. This is a guess. This is a guess. This is data.
Well, there are two elements to this that I'd like to address. And one is just the existence of Do Not Resuscitate, advanced directives on the part of people who are dying of COVID. It's been well known for a long time now, or at least a long time in the sense of during 2020, that this disease hits much harder among people, for example, who are elderly, who have other health conditions, comorbidities, as we now call them, and who are in nursing homes. It makes sense to me that more of those kind of people would have advanced directives documented already, because when you're checking into a nursing home or checking out of a nursing home,
that's the point.
You're going through the paperwork, or even like checking into a hospice program, and
absolutely.
On the rarer occasion, checking out of a hospice program without checking out literally. And so that makes sense that you would have a very high percentage of those people would have a DNR in place. It also makes sense from just a human nature perspective to me that healthcare facilities that have been deprived of the vast majority of their business in the sense that they were told they can no longer do elective surgeries, they have to shut down other aspects of their business and focus all their efforts on COVID-19 patients, would have to find some way to be able to maintain their organization. I mean, when you think about it, it used to be bandied about a lot during the debates over the Affordable Care Act that 1/7 of the U.S. economy is healthcare. And one of the things that I pointed out years ago on a show was when you say 1/7 of the U.S. economy is healthcare, what you mean is a lot of people's jobs depend upon healthcare. And so when you start telling hospitals that employ thousands of people, look, you've got to shut down the 80% of your business or more just so you can focus on this other portion and so that we don't contaminate people who are coming in for elective surgeries, you're really pinching that pocketbook. Hospitals in many ways have been able to take care of the poor, for example, because they make money there's a larger profit margin in doing some of these procedures that are now no longer allowed because of the shutdown orders of various kinds. So, the government offers incentives. The hospital is not going to not take that incentive. The hospital's certainly going to take that incentive because, number one, they need the money. And number two, they realize that the jobs of thousands of people are dependent upon that. And what I was saying before we started recording was it would be fascinating to see what would happen if you just said to a group of hospitals in one area of the country, look, here's the information that we have. Here's the Johns Hopkins data. Here's what the best scientists are saying. You've already got access to all that stuff. We didn't need to tell you from the government microphone. Do what you feel is best. How would they have handled it differently than if the government came in and said, you can't do this, you can't do that, you can't do the other thing?
Steve mentioned that it was a series of, what did you say, perverse incentives?
Perverse incentives is the economic term. That's where you're incentivized to do the wrong thing, which in this case would be to list a cause of death that is maybe not the actual cause of death.
If you take a step back, folks, you can see that there's an actual feedback loop here. And here's how this goat rodeo run by this confederacy of dunces actually got to the situation it's in now. One guy at Oxford University makes a prediction that says that, 87% of the population is going to become infected with COVID-19. And that means 2.2 million Americans are going to die. One guy, one model. Everybody reacts to this guy and this model. Hospitals are told they can't do any more elective surgeries because we're going to have to need every single bed available. So we start seeing a spike in cases. And then what happens? I'll shorten this for brevity. We see hospitals having to lose their profit margins on elective surgeries. And so they list a COVID-19 death in order to get that 20% benefit, which they need because the government has locked them down. So the government locks them down so they can't do any other kind of surgery. So they have to assign a COVID death to a bus accident in order to make up lost revenue. Now, why did the hospital shut them down? Why were they shut down by the government? Because the COVID-19 numbers are so high. Well, how do we know the COVID-19 numbers are so high, the death count? Because that's what the hospital's reporting. So the hospital reports a bus accident as a COVID-19 death. That then goes into the statistics. It scares the living daylights out of anybody and everybody, which then causes them to lock down the hospitals tighter, which causes them to be more dependent on making sure that every single every single death is listed as a COVID-19. And you get this incredible feedback loop of stupidity where everybody's lying to everybody else and nobody is looking at data. No one's looking at fact. No one's looking at reality. No one. One of the reasons that some other countries seem to be doing so much better than the U.S. is in terms of deaths from COVID-19 is because they have this strange foreign idea. And I don't know if Americans will even be able to understand this. I'll try to put this as plainly as possible. There are a few countries out there in the world whose value systems are so alien to ours that when they count somebody as dying from COVID-19, they only count it if that's what they actually died of. In other words, they only count the people that died of COVID-19, not the people that died with COVID-19. And now you know why this entire pandemic has been a catastrophe on so many levels, but on the most important level of all, it has been a catastrophe on the part of the so-called experts who are constantly protecting us from good news, constantly protecting us from news, telling us that this thing is not as mortally dangerous as we're told, and the politics and the money and all of it. Once Steve Green told me that hospitals get a 20% bonus it's a COVID bounty, basically. For every single death that they report and they attribute to COVID-19, it suddenly became clear to me that we are stuck in a hamster wheel of insanity and absolute refusal to face reality. And since everybody's benefiting, why shouldn't we keep going? The government loves the fact that we're locked down. There's no question about that. You just look at the Governor Newsom episode we just did. We're stuck in a hamster wheel of insanity and lack of responsibility, lack of accountability, lack of common sense, lack of freedom, all of it. I'm in favor of Scott Ott's radical idea of letting people decide what risk they think is appropriate and acceptable, and then letting them go out into the world as if they lived in a free country. And if you think that, well, those 297,000 COVID deaths, are there? Are there? Evidence indicates not. Evidence indicates from the CDC, 94% of those people who died of COVID-19 had 2.6 comorbidities. And so you have to ask yourself, how can we know how serious this threat is if we can't know what the actual mortality rates are? And how can we know what the actual mortality rates are if there's a sizable cash bonus attached to inflating them as much as possible? Yeah. This used to be a sensible country. And I miss it very, very much. For Steve Green and Scott Ott, I'm Bill Whittle. We'll see you next week on Right Angle.